Hi everyone, welcome back to my channel and you're watching The Brown Feminist. And in today's video, I'm going to be covering a topic that I get asked about a lot by you guys in the comment section of all my other videos. And that is how to handle interview questions in clinical research positions when you have no experience. So if you don't have a lot of relevant experience in relating to clinical trials or clinical research as a whole, and you're coming in from either a different field or you're coming in right out of school, in this video, I'll be telling you some tips and tricks of how to handle interview questions and still come off as a strong candidate. Now, the number one strategy of dealing with interview questions when you don't have relevant experience is to focus on transferable experience. What that word means is even if you don't have job experience in that particular field or you haven't done exactly what they're looking for, you might have done other jobs. So whether you're coming in from a different profession, a different kind of academic background, or you've just done some jobs throughout high school, throughout university years, and you have some other customer service experience or volunteering experience, there is a way to pitch your transferable skills, means common skills that can be transferred into this industry as well. Because the common things, the common skills, the soft skill aspect of it is the same. For example, if you're looking for a clinical research position which involves data entry, and you are asked if you have prior experience with doing data entry. Now, you might not have done it in the context of clinical research, but throughout your life, it's highly likely that you have done data entry in other ways. You might have worked at the back end of some kind of a store, in retail, in cash, and you can say, while I have not performed data entry in a clinical research environment using health data or human, clinical trial data or data involving patient samples or patient identifiers, I am very good at using computers and picking up different softwares in my past roles, working frontline or working at cash or working in retail. I've had to learn so many different softwares so quickly and pick them up within a matter of hours of being trained on them. And I've done other kinds of data extraction and data entry and making sure things are accurately entered and just, going with the needs of the software pretty fast and just roll with it and just do a very good job of it. Be meticulous in making sure the correct data, the correct amounts, the correct numbers are entered. And if there's any confusion, know how to troubleshoot those problems, come back and solve them. So that's an example of how you can demonstrate transferable skills for data entry. Another example is they might ask you, have you had enough experience or any experience working with patients? While you might not have worked in clinical research as a job, you've probably done some volunteering. Whether you've done it through school, in high school, in the community, wherever you might have done some volunteering work, you can pitch it like this. You can say something like, while I haven't worked in a clinical research role with patients, I have done a lot of client-facing or customer-facing roles where I have engaged with diverse populations. Maybe you've worked with children, maybe with youth, maybe people with disabilities, maybe children with special needs, maybe the elderly, maybe adults, maybe people of different socioeconomic backgrounds or language backgrounds or ethnic backgrounds, right? Even if you've served in a soup kitchen, even if you've served in a community fair, even if you volunteered at a hospital, there's so many ways of pitching those experiences and saying that while I haven't dealt with patients in a clinical research job, I actually have a lot of exposure dealing with patients or dealing with clients of various populations and handling like critical environments and de-escalating situations of conflict, and then guiding clients through different processes. For example, when I was volunteering with the Canadian Blood Services. One of my responsibilities was to, speak to the general population and encourage them to donate blood. And a lot of them would come to me and have some more specific questions. Some of them I could easily answer, while a lot of them were more medical, were more clinical. So I was able to collect those questions from them, build a good report and tell them that I would speak to somebody on the nursing side or medical side and get back to them with the answers, or I would pass on their contact number and go those answers to them. Sometimes people would come in to donate blood and they would be in a rush. They would have to be rushing off to work and things might be behind in their time. So, and they would get a little angry, a little agitated or irritable because it was taking a lot longer than they had expected. So during those moments, I was able to communicate with them, why there was a delay and how much, longer it might take, what the expectations are, and just re-engage with them and remind them why they're there and thank them for this contribution and tell them a few stories of, what kind of impact their donation has. And that way I was able to de-escalate the situation. So even though I haven't had a clinical research job per se, by my volunteering work at the, blood donation clinic, I've actually interacted with a wide variety of client environments, and I've helped people starting from seniors who don't necessarily hear well or who may not have a very good understanding of the processes. It might take them a little bit longer to understand the complexities, and boiling things down to a pace language that they're able to follow through very well and have good understanding for informed consent, to just giving people directions and understanding the logistics and passing them on to the general audience. In that way, I would say that I have had experience working with like dozens of people, managing groups of people, managing people individually, people of different backgrounds from all age groups. That's something I've had exposure to. I've also worked with children before. I've worked with children who have various disabilities or special needs. So I'm really, well accustomed to engaging with that clientele. So there you go. That was another example of how you can pitch your transferable skills that not necessarily from a clinical research job, but you can pitch it in a way to say, I might not have done exactly what you're talking about, but the essential skills of what you're looking for have been covered in this other thing that I did. And then you can show some of those similarities and the things you've learned there that you can pitch right here. Now, this was one good strategy of how you can handle interview questions when you don't have a lot of relevant experience. Let's talk about number 2. For number 2, we're going to be talking a little bit about showing skills when you have zero work experience. And this isn't ideal. There's lots of ways to actually go ahead and get experience, but let's just talk about a hypothetical scenario. You haven't done any work, you haven't done volunteer work, or anything that you've done, you can't really find a way to link it back to clinical research. In those cases, what you can do. So one of the things is you can fall back to your academic training and whatever you've done in school, in college, in university, and find ways of showing how you've learned skills there. Again, this is a weaker answer than if you show transferable skills from other jobs to the clinical research job. But if you can't do that, like for what it's worth, you just can't think of a way to make those transferable skills, then you can actually fall back on academic background. For example, if you've done like a bachelor's degree, if you've done any research for any project, for let's say you didn't have a thesis, but you had some kind of research papers and you had to write these essay style questions, and you were asked, what kind of research experience do you have? Have you ever been involved in research? Have you done any courses in research? Like, what is your research experience that makes you relevant to this role? So one of the ways of pitching that would be, while I haven't had an opportunity to engage in doing research through a full-time job, I've actually always been very interested in it. And so when I was doing my degree in blah, 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 I took these courses. Even if it's like an English course or a history course, you can say I took these courses, for example, this English course where I had to do a lot of questionnaires and surveys and get people on campus to fill them out. So I did like primary data collection. I designed my own surveys, and then I designed like a way to do the study with the methodology. I was able to extract them. I was able to summarize them. I was able to write a paper on them. And then I did a lot of APA or, MLA citations. So I know how to, prepare components of a research paper, even though I haven't been able to publish yet. But all of these courses have trained me on how to look up research articles on databases, look up how to find primary and secondary sources of data, how to generate data through like qualitative surveys or quantitative surveys, mixed methods. Through these courses, I've actually developed a very strong understanding and foundation of, strong, good clinical research methodology and how to like abide by them in order to, promote data integrity in research methods. So that's an example of a way that you could pitch some things that you've learned in your academic training and pitch it in a way that makes it look like, okay, you have some experience, even though you haven't worked it in a job or a volunteer role. Another example of pitching something from your academic years could be some extracurricular activities. So they might say, do you have experience managing people or, project management? And you can say, I haven't done project management in a professional capacity yet. However, I have been the XYZ Prime Minister, President, or head of like some debating association or this association. I was lead volunteer here. Some kind of a leadership role maybe you've had in your academic years or in your community events. And you can say, and through that, we had to do fundraising. I had to encourage people to join. And so I have that, knack of communicating to encourage volunteer participation of people, even though they weren't patients, but there were people who were giving us free time and free effort and helping us raise funds. And I was able to gather that and I was able to manage them, identify the different skills that each of them had. And some people I used to, allocate them to do more design and marketing for the fundraiser. Other people who had special skills, I used to set them up so they could, promote their skills at a stall. And, people would see that and get entertained and raise funds that way. Another person became the treasurer and I was in charge of overseeing all of that. So I do have some experience in managing things in an event setting. Having said that, I would love the opportunity to, reestablish how I can use those skills and transfer them in a professional setting, especially working in clinical research. I'm sure it's like a much more serious and in-depth capacity that you're looking for. And I'm really interested to learn that and to, grow and nurture those skills. So this was another example. Again, I'm going to repeat this. Bringing examples from school years in academia is a weaker answer in an interview compared to bringing it from other jobs that you've done. Now, let's move on to the third example or the third strategy in which how you can actually handle interview questions without having a lot of relevant work experience. This third strategy will talk about scenarios where you have come in from a different profession that is not related to clinical research. So how would you then use that other professional experience and show that you can do the job in clinical research? So an example, let's say you've done a degree in social sciences or sociology or psychology or chemistry or physics. So let's start with a set of social science examples first. So think about any kind of commonality that you can think of. Do that as your interview prep. Write down a column and see what things you've done in your academic training, your professional training that is somewhat similar to what the role is in clinical research. For example, you might have worked in a psychology kind of research team where you had to deal with grant budget. So you can say, I have had the opportunity to support a psychologist or to support like a neuroscience or a psychological project, a social project where we were funded by a grant and we had to stay within the grant deadline and the grant budget and ensure all of the research objectives were met. While that was outside the scope of clinical research per se, we weren't working in human trials. However, that did teach me about how grants function. Because the way that government grants function or taxpayer funded grants function are very similar, even if you're in a different specialty. So use that to your advantage. Talk about how you understand the research process of getting ethics approval, of collecting data, of dealing with a grant, writing grant applications, doing research paper writing, research publications, or just dealing with humans as subjects, and how you might have done some psychological, neurocognitive testing, or how you might have done qualitative interviews and collected data from those interviews. And through that experience, you know how to recruit people to participate in your study, recruit people to encourage them to, you know, buy into the idea of why you're doing this research, why it's important, and therefore give them their valuable time for free. And you did your, you know, you conducted your study through these interviews. So by doing that, you're really highlighting and showing them that you have a high level of experience, even if it's in another profession, but it is highly translatable to your role in clinical research. Because even in clinical research, you'll have to deal with grants, you'll have to deal with budgets, you'll have to deal with tight deadlines, you'll have to try to convince people to give them your time, or to, you know, convince them to participate in your study by telling them how cool and how exciting the study is and how much good it can do from the community by understanding that disease better, or by finding a drug that works better. So your ability to connect with people and to talk to them in a way that explains complex scientific concepts in a simple way for the lay audience to understand, and to, you know, abide by research ethics. All of that would be similar if you've done any kind of research in social sciences. A lot of the principles taught in social sciences will then translate over to clinical research. Now, let's say as another example of this, that you haven't done any kind of social sciences either, and you haven't done any kind of health sciences, and you've just come from a background in like chemistry or physics. In that case, your best bet might be to pitch your understanding of research methods. Of course, chemistry, physics, very research heavy subjects. You know, your ability to read complex concepts and understand them and explain them to either a scientific audience or a lay audience. You can pitch that in your interview. You can talk about how, you know, you've had to go through so many research papers and so many complex textbooks and understand complex concepts. And that really, you know, it gives you an edge in research, where you have to read these study protocols and understand, you know, effects of drugs and understand all of this, like the nuance of running these studies. And you're very like accustomed to considering safety as an issue when you're running experiments in a chemistry lab or doing physics, and thinking of long-term goals and thinking of like the budget. For example, when you're designing physics experiments, some of the long-term goals and the strengths of the study are, you know, right now a procedure consumes this much cost for the economy or for the average person when they're using these things, or it's not as energy efficient, but by doing this we can make it cost efficient, time efficient, energy efficient. So your idea of being able to create those, you know, very efficient processes and streamlining things and just having that vision also does translate to clinical research. The farther you go away from health sciences, the harder the pitch is. And I'm not saying that every person that's interviewing you is going to buy into that, but this is better than just being quiet in an interview and saying that, oh yeah, I know I didn't do that. Make an effort, you know, show them that you have the capacity to at least think outside the box when you're giving that answer, and you have the capacity to retain things you've learned in other fields and apply those and bring those with you to clinical research. Of course, they will know if you get hired for these roles, they will know that you need more training in clinical research, that maybe you just have an interest, you need to you know, enter through like a very basic, very entry-level role, but they will also know that you are smart enough to pick up the nuances of that industry, anything that's niche about the clinical research industry, much faster, because you were able to come up with this kind of an answer and see the, you know, the skills that are common across both industries, the patterns that parallelly support both industries, whether it's chemistry or physics or social sciences or psychology or whatever, and you were able to pitch a very strong answer, you know, with whatever you had at hand. Now, a lot of the times they do want people with a ton of relevant experience, in which case that might not be a good fit, no matter how good of an answer you do. But you know what? If you give a very good, strong interview, they might still remember you for another entry-level role coming up. They might still keep you up as their second candidate of choice, as a candidate who was speaking very well-spoken, but maybe just didn't cut the mark for that most relevant experience. They might have other roles available in the future, which just needs a part-time casual, and you might still get an entry, a foot in the door for those kind of roles. Also, of course, apart from these, I do encourage all of you that if you have decided to go into clinical research, Try to get some relevant experience, at least by doing volunteering in a hospital or a clinic setting or in the community. Try to get an internship or do a postgraduate certification of sorts. Watch all the crash courses that are on my channel, and you can pitch in the interview that you have a thorough understanding of the clinical research process, even though that's not the field that you studied. You've done a lot of self-study, and you're able to, you know, fully grasp how things are typically run in the country. So these were some of my strategies of how you can handle questions in interviews if you don't have relevant experience in clinical research. I hope this video has been helpful for you guys. As always, don't forget to give the video a thumbs up, subscribe to my channel for more videos like this, and please give me more questions, comments, and suggestions in the comment section. Until next time, this was the Brown Feminist. Bye. Hey guys, before you go, don't forget that I do offer one-on-one career counseling services in clinical research. So if you do feel that beyond the videos and the emails where I answer all of your questions, you need a little bit more of hands-on support, you're not getting those interviews and you're not really sure why, or you just don't know how to handle certain questions because of your, you don't have all the experiences, but you know that you can do the job. If you need some additional help in resume building, cover letter design, interview prep, or just general career consultations, I do offer this service now live. Find out more by clicking the link below. I have a whole video where I explain what services I offer, and there's a form there if you would like to sign up. Until next time, this was the Brown Feminist. Bye!